All right, everyone. Good afternoon, and thank you so much for joining us all today. My name is Alice Buffkin, and I am the Director of Policy for Child and Adolescent Health at Citizens Committee for Children, which is one of the steering committee members for the Campaign for Healthy Minds, Healthy Kids. We want to thank everyone for joining us for today's conversation and today's press event. The Healthy Minds, Healthy Kids campaign formed over a year ago with the goal of ensuring that every New York child receives the high quality behavioral health services they need. We're here today to raise awareness about the urgent challenges facing children and families in New York in need of mental health and substance use supports. We're also here to urge our state leaders to fight to make sure that we invest in children, in families, and in the future of our state. For those of you watching on Facebook Live, we want to encourage you to participate by sharing your stories, sharing why you think it's so important to invest in children's behavioral health, and by visiting our Take Action page to contact your elected leaders. I now want to begin opening it up to our speakers. Each of them can speak powerfully to the unprecedented mental and emotional challenges facing far too many children in the state. But they can also speak to the enormous difference that it makes when we invest in a full continuum of behavioral health supports for children. To kick us off, I'd like to hand the virtual mic over to an incredible champion for children's behavioral health, Assemblymember Eileen Gunther. So give us one moment and we'll be very happy and pleased to hear from Assemblymember Gunther.
Can you hear me?
Yes, we can hear you.
Okay.
Welcome.
Good afternoon, everybody. And, this is a very important issue as chairperson of mental hygiene and as a grandmother of 6 children that haven't gone to school. My son is a teacher. My sister is a speech pathologist. And I hear real life stories every day about how children are reacting to being isolated, to meeting with their teachers over Zoom, and just a very difficult times. And over the years, I'd have to say that the state of New York has not really invested in children's mental health. In our schools, we used to have many social workers. Now we're lucky if we have one. And I think that the executive branch has to go back and take a look at this, as well as all of our boards of education, and make sure that they provide monies for these kinds of services in the school. A lot of our children, the only place that they have, especially in upstate New York also, and also in New York City, a school is a place when they go there, they have a captive audience. But I know from my son and my sister that a lot of kids aren't even coming on Zoom to take their classes. And this isolation is going to create a lot of havoc in the future. So I think that our ask this year from all of you should be increased amount of funding in the budget, in this budget this year. It's so important. It's so important for all of our therapists across New York State, all of our non-for-profits that are offering these services, and also for our schools. Social workers are few and far between. When children do go to school, they spend a great time with their teachers and their teachers' assistants, and also many of them stay for the after-school programs. So that's a place where we have a captive audience, and we can also provide those services. I think that cutting any children's mental health is really a travesty. I think that, write to your assembly people, your senators, write to the governor, write to the leaders, both Andrea Stewart-Cousins and Carl Hastie, to say that this should be a priority. This is the next generation of adults. And if we don't have intervention now, they'll carry it with them for the rest of their lives. And, I feel very passionate about this. I have been, every year I beg for money for mental health. And you know what? It's really getting very frustrating that we don't put the emphasis on our children, our children's needs, and more than ever this year. You know what? You got to keep talking. You got to call the executive branch. We got to call Carl and Andrea Stewart-Cousins, and we have to say, hey, this is a priority for our children. This is the next generation of leaders, of workers in New York State. And if we don't do it now, there's going to be a lot of aftermath. for not doing it. And, I'm here to work with you. You can call me at any time. And I feel passionate about it. Sometimes I want to pull my hair out to get people to get motivated. And, if you have interactions with parents, grandparents, tell them, call your representative. Thank you.
Thank you so much, Chair Gunther. You have been such a champion for children and for children's behavioral health in particular, and I think your words are so well taken. I think that the issue of making sure that we have supports in schools is so important right now, especially as we are seeing the challenges not only for students, but also for teachers, increasing those behavioral health supports, both clinical services as well as supports for things like wraparound services in community schools. But I think your call to reach out and to act and to reach out to our elected officials and to make this a priority and make this real call to action that you made around this is the future of children and families. And if we don't invest now, we will see the long-term repercussions and the harm that's done to our state. So we really want to thank you for your support.
And I also just want to say that, one of the most important things that we can do is make sure that we have our ducks in a row, that our children have available to them the intervention that they need. And I think that's very, very important. My sister, as a speech pathologist and working with kids with disabilities, it's very difficult, and they have to really, improve the number of people that are working in our school districts that can interact with these children.
Yeah.
And it's the next generation. And if we don't act now, we're only going to suffer later on, and they will suffer.
Exactly.
So thank you very much. Love you all. Keep doing what you're doing. Keep advocating for these kids. And you know that I'm here. You can call our office in Monticello anytime. There's always somebody here. And if you have good ideas for legislation, pick up the phone. I get my best ideas for people that are working in the trenches. So I appreciate everything you do. And God bless you.
Thank you so much. Thank you for all your work and your commitment.
Thank you.
Thank you. So yeah, what a great way to start, because I think that we really, we know what works. We are seeing enormous challenges in the state, but we also know we have the tools to get services to children and family if we only have a commitment as a state. And so in following up from the Assembly members' comments, I next want to turn to our next speaker. And I'm really privileged to invite Dr. Warren Ng, who is the Medical Director for Outpatient Behavioral Health at New York Presbyterian Columbia University Irving Medical Center, and the Director of Clinical Services in the Division of Child and Health Psychiatry at the Columbia Irving Medical Center. So Dr. Ng, I want to go ahead and turn it over to you to make some remarks around what you're seeing on the ground and the impact we're seeing on children's behavioral health.
Thank you so much, and good afternoon, everyone. And it was wonderful to hear the inspiring words of our Assembly Leader Gunter in terms of the passion and the leadership, but I'm also thanking all of you for coming to this call to action for children's behavioral health. As a child and adolescent psychiatrist with the privilege of serving by leading our programs within Northern Manhattan, as well as president-elect for the American Academy of Child and Adolescent Psychiatry, we are definitely seeing firsthand the devastating impact of this pandemic on children, youth, as well as families. But similar to COVID-19, disproportionately affecting our communities of color. Further is exacerbating really the disparities and inequities within our system and within our structures. As JFK said, children are our world's most valuable resources and our best hope for the future. And similar to Assembly Leader Gunter, we need to invest now because the future is here. So before the pandemic, we were already at a crisis. When you have 1 in 5 youth having a behavioral health issue, getting in the way of achieving their potential in life, as well as 50% of all adult mental health conditions starting before the age of 14. And with less than half of them receiving the care they need and deserve, we're definitely at a crisis. What also exacerbates that is the fact that suicide is the second leading cause of death for adolescents 15 to 19, and the third leading cause of death for children younger than that. But we also see the disproportionate impact on our communities of color, as Latina youth are experiencing the highest rates of suicidal ideation as well as suicide attempts. And Black children under the age of 12 have a death rate that is double other groups for racial and ethnic groups within children. So I think that we're definitely at the moment where the pandemic has made everything even harder. So with the United Health Fund's study, The Ripple Effect in 2020, last year, it showed that about 4,200 children within New York State lost a parent or caregiver to COVID-19. However, when we think about our children who are Black, 1 in 600 Black children lost a caregiver or a parent, and 1 in 700 Latinx children. So that's double the rate that are other ethnic and racial groups. On top of all of these things, it's really the devastating impact on our families and the fabric of our communities. So when we understand children, and you heard from Assembly Person Gunter, really children are affected by their experiences. So we have the adverse children experiences in terms of looking at how these traumas can affect their future in terms of their health and well-being, as well as their potential to contribute to our society. We are experiencing a second wave. It's really an invisible wave of mental health and behavioral health concerns. And many of the programs that are meant to serve our children within our communities are at capacity. So we need action now in terms of advocating for more services, the most appropriate ones. And a study done by the Centers for Disease Control, looking at emergency room visits for children and adolescents across the country, there's been a 25% increase on mental health related visits in the emergency department for kids aged 5 to 11, but 31% increase for young people aged 12 to 17. I'm sharing these numbers as statistics, but the human stories really reveal the true impact and the true cost on all of us and our society. So giving testimony is really what's most important, and our next speakers will share those human stories so that we can further really understand how we can best take action. But thank you so much for your time and for your action and commitment to this cause.
Thank you so much, Dr. Ng, for your words today and for your work for New York's children. I think Dr. Ng really lays out the scope of the challenges that are facing children and families in New York and the toll this pandemic has taken on them, especially on children of color. But he also points to some of the good work that's going on around the state and the progress we've made in developing interventions that help children who are experiencing mental health challenges. Now what we need to do is invest in that system that reaches every child who needs care. So we need to build capacity, especially now as we're seeing, as has been laid out, more children who are experiencing new traumas, new insecurities, new loss. At the same time, it's harder and harder for them to access services. So this is really the time to dig in now, get those supports out to children, and make sure that we have a really important sort of future for the kids and families that are in our state. So to speak more about the urgency of this time and the need to fight for children in New York is our next speaker. Kim Kaiser is a regional parent advisor for Families Together in New York, and we're so happy to have her join us and speak to some of these issues.
Thank you, Alice. Thank you, Dr. Ng, for those statistics and the demographics, which I call demographics of pain. Because in May, a young man said to me in the Bronx, "I hope my grandmother doesn't end up on one of those trucks." By July, his grandmother ended up on one of those trucks. So we have thousands of kids who are waking up this morning without their lifeline, without that connection, without that nurturing and that love, without that embrace of hope that every child should have in their biological, adopted, chosen family, in their grandparent, their parent, their aunt, a neighbor. Their key point person is gone because of COVID. And over 300,000 of our children are waking up this morning having been thrust into a new level of poverty. And for those who did not know true poverty before, they're knowing it this morning. And with poverty comes homelessness, food insecurity, and I dare say it exposes our most vulnerable to things such as violence, human trafficking, and other sources of pain. Because COVID came in like a storm, like a dust cloud, and within it contained the soldiers that delivered increasing numbers of suicidal ideation and suicide, increasing numbers of substance use and overdose, increasing numbers of depression, anxiety, exposing us bare in terms of our telehealth absence, then our telehealth inequities, our educational deficits, and then our educational gaps. We have been attacked. We need to look at this as if it is a war, and we are allowing our children, as happens in so many wars, that our children become the collateral damage. So we can't allow this to continue. These demographics of pain each have a face. And it's the face of a child that deserves hope, a child that deserves a fighting chance, a child that deserves an equitable access to their future, because they're our most valuable commodity. So if we divest and we do not invest in our future, then what are we doing? We have closed doors, extended wait lists, way above capacity, and all of the facilities, the agencies, the clinics, and I dare say even the private practices of individuals who could be there to help. We can't do this because what the message we're sending is apathy, and we're turning a blind eye. So we have to heal our children. We have to give them hope, and we have to focus on investing in the present condition we are in and ferociously invest in the future. Because I never want to talk to another child that has to go to bed every night and pray that their primary source of care lives to see another day. It is not right. We have got to invest in our future.
Thank you so much, Kim. I think that is such a powerful response and a powerful, discussion of the pain, the real personal impact this is having on individual children, on individual families throughout the state. This is like something we've never seen before, but at the same time, it is exacerbating things that have always been there. So thank you so much for really putting out that call to see the personal harm and pain this is doing, and also to have that call for hope, which is that we can fix this if we have the commitment, if we take the agency to really fight for our children and for our future, as you laid out so well. So thank you so much. I now want to turn it over to Ron Richter, who is CEO and Executive Director of JCCA. And Ron can speak to some of the steps that the state can take to address many of the challenges that have been raised by speakers throughout this conversation. So Ron, I will go ahead and turn it over to you.
Thank you so much, Alice. And Kim, that was a really wonderful call to action and really set me up beautifully. So thank you so much. And to Dr. Eng and others out there, Assembly Member Gunther, thanks everyone for joining us today for the campaign for Healthy Minds, Healthy Kids, and across New York State in support of children's behavioral health care and hopefully children's preventive behavioral health care. The children we work with at JCCA face seemingly insurmountable obstacles, and Kim talked about some of those. There's poverty, there's disability, there's housing instability, sometimes neglect, less often abuse, all stemming from longstanding racial inequalities. These are the same children who have been hit hardest by the pandemic. We see firsthand how kids are coping with the compounding trauma of unstable housing, real fear of the COVID-19 virus, and in fact, actual fear because they've seen it hit their loved ones. We've seen them deal with loss, isolation from school and their friends, their teachers, racial injustice, and political unrest that leaves kids in bed at night, nervous, wondering what tomorrow might bring, as Kim described. Young people referred to our case management programs are presenting with significantly increased needs since this pandemic began. These programs were designed to balance caseloads with a range of acuity levels. However, in the words of one JCCA employee, no one is low acuity in this pandemic. We've seen a marked increase in young adults who have suicidal ideation, terrible self-harming behaviors, eating disorders, especially during these winter months when we're all feeling how strange it is to be closed in. Our staff is able to address and support these concerns, which underscores the need to fund and support behavioral health services at a time when so many more young people are feeling severe isolation and stress that significantly contribute to serious mental health challenges. But in spite of this increase in the need for services, providers are seeing a dramatic 44% decline in screenings and outpatient mental health services for children in CHIP and Medicaid. Meanwhile, the number of young people entering the hospital for dangerous psychiatric emergencies is on the rise. This means that too many kids are falling through the cracks, and the consequences are absolutely devastating. As our leaders in Albany map out our state's recovery from this pandemic, investing in children's behavioral health services and family supports are absolutely essential. The state has to protect child and family services from harmful draconian cuts and increase investment in clinic and community-based behavioral services. Ensure equitable access, as Kim said, to telehealth services so kids can safely get care from home where they feel safe. These children are our future. They are New York's greatest natural resource. If we fail to provide them with the counseling, psychiatric treatment, and therapeutic rehabilitation they need, we're going to pay for it. I heard someone say the other day that this is like no other recovery. This is like what happened to Europe after World War II. We have been bombed. We have been attacked from all sides. If we don't try to rescue and rehabilitate our children, then the next 40, 60, 80 years are going to be really bad for our great state. So it is time to pummel resources into children because they are going to be the ones leading 20 and 30 years from now. They will be us. Let's think about that and figure out how to invest wisely.
Thank you so much, Ron. I think Ron is really helping reiterate so powerfully what we're hearing, which is children and families are suffering more now than ever, but also our ability and our opportunity to invest in children early, in early care settings, in pediatric settings, in homes, in schools, across the continuum from preventive services to clinical services. These are all the tools that we know are there, that are available, that can make a difference. We just need to put in the effort and make our state really commit to that future that we've all been talking about, which is our children and who they, and the opportunities that we want them to have as they're growing up. So our next speaker is going to speak to some of the ways that we can increase access to services and combat a lot of the deep-seated inequities that are being discussed today. So I'm going to now turn it over to Teresa Hassler, who is the Vice President of Government Affairs at SCO Family of Services.
Hi, good afternoon. My name is Teresa Hassler, as Alice said, and I'm also a member of the Healthy Minds, Healthy Kids Telehealth Equity Subcommittee. The pandemic has impacted children and families in ways that are almost too complex to comprehend and measure. The barrage of life-changing and culture-shifting events that have occurred over the past year have only begun to scratch the surface of historical racial inequities in every area of American society. The wounds of years of exploitation and experimentation on vulnerable populations has resulted in a justifiable skepticism and hesitation by Black and Brown families and children to engage in America's healthcare system. Additionally, the digital divide isn't just an abstract concept, it is a main driver of inequality that we can no longer ignore. Black and Brown families have lacked equitable access to broadband and devices needed to function in an increasingly digital society. The economic impact became more obvious when observing the transition to remote work for those privileged enough to have employment and resources at home that allowed them to continue to earn a living, while businesses have suffered and many vulnerable populations without these resources were left jobless. The pandemic has touched everyone mentally and physically. The disproportionate death toll on the Black community has been unmatched and has served to highlight the gap in healthcare access, diagnosis, and treatment. Telemedicine is now a new method. It is not a new method, it's not a new method of service delivery. However, the pandemic has caused an immense expansion of this method for treatment, while failing to properly acknowledge and address the historic practices that have failed many Black and Brown children and their families. Prior to the pandemic, telemedicine was a luxury, accessible to those who had the resources to receive healthcare and therapy without having to be present in a doctor's office or emergency room. While many Black and Brown families, adults and children relied primarily on in-person visits and the emergency room for treatment. While New York has done much in the way of telehealth expansion, it hasn't gone far enough. It would be a violation of human rights to consider our mission accomplished by implementing telehealth without addressing those children who are differently abled and don't respond to treatment that is not hands-on. It would be a violation of human rights to consider our mission accomplished to not address the well-established privacy issues that Black and Brown populations contend with when sharing personal health information. It would be a violation of human rights to expect vulnerable populations who lack the adequate privacy in their homes to engage with a mental health provider and would rather forego treatment than risk having someone in their very limited space hear them speaking about their fears, traumas, and concerns. It would be a violation of human rights for New York to ignore the numbers of Black and Brown people that have died in the past year, who didn't have adequate burials, whose children are grieving and have no place to turn because of the lack of resources and access. Telemedicine is critical, especially during this time when everyone needs to socially distance and maintain their health. However, we would do a great disservice, New York, we would do a great disservice if we did not first acknowledge the racism that is embedded in our healthcare system, if we did not acknowledge the racism and the impact it has had on children and families, if we did not acknowledge and address the racism, its impact, and the resulting mental trauma that many of our children face. We cannot face this issue in a vacuum. Telemedicine, while important, while essential, has to be handled in a way that takes into account all of these inequities. Doing so would be a violation of human rights. Thank you.
Thank you so much, Teresa. And thank you for speaking to sort of the moment we're in that is in many ways just an extension of where we've always been along racial inequities, along entrenched racism in a lot of our healthcare systems. But we are looking at a new world and we need to look at how telehealth fits in that. So I really appreciate your words on referencing how we need to address the digital divide, how we need to make sure that we are not continuing to deny so many essential services to children, how we need to make sure there's parity between telehealth and in-person services, make sure the state has a proactive strategy for reaching all the populations of children and families that you referenced, those children who are at risk of being left even further behind because of the pandemic. So thank you for really tying that into what we are looking at now and what we've been looking at for a long time within this country. And so finally, thank you so much to everyone who's been speaking. I want to bring us to our final speaker. Amanda Davidson is a youth advocate and communications coordinator with Families Together in New York State. And we're gonna have her share her story with us. So Amanda, I'm going to go ahead and hand it over to you.
Hi, everyone. My name is Amanda Davidson. And as everyone said, there are thousands and thousands, and probably even at this point, hundreds of thousands of young people and children who need services. And especially with telehealth being accessible, we need to do better. I graduated high school in 2016. Wow. But I am one of those young people. I am all of those numbers. I am all of those percentages. As my daughter sits here and eats lunch, I fear for her. I fear for everything that's going on, although it may be something that is farther down the road. I was one of those percentages. I had very violent domestic violence experiences. I've seen the substance abuse. I've seen the addiction. I've seen the neglect, and I've been it. I'm it. You're looking at it. But this is where the investment comes from. We have struggled in previous years of proposing cuts and proposing all of these necessary treatments and services that need to be implemented. We're proposing on cutting those. I think about a lot about my life and where I would be now if any services were cut, and I don't know if I would be here. I've experienced complex trauma. I've been in those situations. I've been struggling. I've been scared. I've been one of those children who fear to go to sleep at night because I don't know what's going to happen. And maybe in different circumstances in regards to my parents, but snowball effect is a real thing. And we talk about saving money and saving this and saving that. But what about right now? What about the children and the young people and the young adults who need those services right now? Right now is not the time to be cutting services, especially when so many children and families are suffering and they're trying so hard to stay afloat. I get goosebumps talking about this because this is a discussion we shouldn't even be having, but we are. And I'm so honored and proud to be a part of this and a part of this history to challenge our elected officials, to challenge our lawmakers that you can make a difference and you can make the right decision for your community. You can listen to your community and you can be a part of the solution. You know, you don't always have to be a part of the problem. Life is a lot more positive, and we need to focus on the positive. I like saying that Newton's third law, for every action, there's an equal and opposite reaction. And I truly believe that if we cut these services, if we diminish the access to telehealth, that it'll have a very severe reaction to the future. You may be saving money in the short term, but are you really going to be saving lives and promoting a positive history with being in a global pandemic? It's something that I worry every day, and it makes me worried for my daughter and all the other young people like me who have children and who have gone through that. We worry. But just ask yourself, is this going to be the right decision? Is this going to make the young people feel empowered and be able to get through this? There's a right path and a wrong path, and you have the choice. And we're here to tell you to make the right choice.
Thank you so much, Amanda, for sharing your story and for sharing how personal this is, how we are talking about young lives that have the potential to be amazing, successful, resilient individuals, every single child in our state, but they need the support that we can offer them. And these are not, when we talk about budget cuts, these are not abstract things. These are things that impact individuals, and these are things that impact children and their ability to thrive in the future and their families as well. So really want to thank you so much for sharing that and for sharing your own experience and how you have both struggled but also been able to really thrive in response and be an amazing advocate today. So thank you so much. And I generally just want to thank all of our speakers today, including Assemblymember Gunther, Kim, Teresa, Dr. Ng, Ron, Amanda. All of you have been incredible advocates for yourselves, for your families, for your communities. And these are all powerful examples that our presenters have provided and experiences. And they really help paint a picture of the challenges that were facing so many children before the pandemic and the way these challenges have been intensified after it. But all the speakers have also spoken to the actions that the state can take to help children and families. We can resist cuts to children's behavioral health services and to the providers that offer them, and instead make investments in clinical services, in school-based services, in the Child Health Plus program, and the services that help the youngest children and their families. We can strengthen access to telehealth and address disparities driven by historic racism and other inequities. We can make real targeted investments in the continuum of care to make sure every child has the behavioral health services they need so that children and families are able to recover and thrive. If we don't take action now, we will see the harms play out for generations to come. But if we act now, we can have a better future for families in the state. So I know many of you listening to this event are committed to fighting for children in the state. We thank you for participating today, and we urge you to continue advocating to strengthen behavioral supports for children and their families in New York. So thank you all to the work you do, and we hope you continue it. Take care.
Hi, everyone. So thank you again. So we just ended the live stream. So appreciate the patience at the beginning, and thanks again. I don't know if anyone who's still here has any questions before I end the Zoom meeting as well.
And I realized we did not settle on a plan for after the end, so I should have had a moment for everyone to convene. But I see Amanda and Kim are still on there, and I just want to thank you both so much. We have already been, just during this, we're getting just feedback on how incredible everyone's speaking was. So I just want to thank you all so much for your time and for sharing your stories and your passion on these issues.
No, thank you so much.
Yes, thank you. It turned out very well. It was awesome.
It was awesome. Amanda, you're a rock star. I'm sending love.
I know, I haven't seen you before you.
It's so weird. It just,
I know.
yeah, I had to, because it was a little emotional for me, because when
Yeah.
I followed up with that young man and I'm going, first of all, I'm like, why didn't I follow up? And I'm like, I've been so overwhelmed.
It's hard. It's
I'm
so
from
hard.
the city, you know, I'm living up here, but it's like, I can't go home. I
Right.
feel like there was a war that happened in my home, and now I feel like a refugee in Albany.
It's
I
sad.
miss my family.
I don't blame you. Sorry.
So I'm going to get off now
Kim.
because I have to call this young man.
Well, thank you,
Have a
Kim.
great-
Take care.
Yeah, you too.
You too,
Yeah,
Amanda.
Have a great rest of your day.
Yeah, thank you both.
All right, I'll talk to you soon.
Take care.
Bye.